when you're having a baby. You know, it's the most important time, I think, in anyone's life, and you want to honor what the patient wants. One of the first things that we do is we ask them what their preference is if they have a birthing plan, because it's this one experience that they have that we can't repeat. We want it to be the very best that they can have while they're here.
Our oldest is 16, our next daughter is 12, our son then is 4, and then we have Hadley here who's just a month. This is beautiful. It's changed incredibly since our first one 16 years ago. I was just impressed where I just didn't have to leave the room. So I labored and delivered in the same room, and that was special to me.
But the advantage to that being here at St. Francis is you can have that home feeling of being right there at the bedside and know that there's someone there to assist you if you need it. So during that 24 hours that they're with us, that's what our goal is to help them to know the baby and also get a feel of what it's like to care for the baby.
It's so special to have your baby with you right away after he's born. That mother-to-child connection, the skin-to-skin contact. I can't say enough about having the baby with the mom at all times, because you've bonded with that child for 9 months and they're finally arrived. And it's just a special connection. I'm sorry.
It's most important when the patient comes in is actually finding out exactly what they want for their labor. Some people don't want any pain medication. They want to try and do it. So positioning, we have the jacuzzis. We put the patients in the tub. The warmth, the water helps to defer some of the pain. It helps to also have them focus more on being relaxed. The birthing ball is wonderful. When you're sitting on the birthing ball, you're actually suspended. So that kind of helps decrease the back discomfort. Walking is wonderful. It actually helps to take their mind off of being stuck in just one area, and it also helps increase labor.
The experience at St. Francis that I appreciate is once you enter the hospital and are put into your room to deliver your child, you don't leave. You don't have to go to another room to deliver. You stay put. Everything's there that you need. You can just put all of your things in one place. You don't have to worry about transferring things, moving things. People know where you are. It's easier for the family.
The room was extremely spacious. It was so centralized around the family that was there. They greeted us. They took us to our room that was already ready for us. It was ready for us to be accepted there as part of the St. Francis family.
We like to also make sure that we're addressing his need, so we're really good about wanting to teach Dad. We try to encourage Dad to be right there, and even during delivery, it's the same thing. We want Dad to be right there next to Mom so he can help assist her and encourage her.
She's the one that should be getting the tending to until he comes around, and I didn't expect to be in any way looked after and all that, but I mean, they were with her, with me, anything that I needed, and I mean, that just floored me.
Here at St. Francis, it's wonderful because we can bring in the equipment we need for delivery, and right after delivery, those things are moved and put away so that it then goes to like you're being right there at home.
Right after, whenever we was ready for family to come in, it was open door. It was very welcome for everybody to come in, and you could get both grandmas there, grandpa, older sisters and brother to be there, and there was plenty of room for nurses to move around and do their duties, doctor to come in. It is a Class A1 facility.
They were very attentive to the extended family, taking care of them, making sure that they had everything that they needed or wanted, and just made it very comfortable for all of them to be there with me. It was almost like my mother taking care of me, very loving, making sure everything, they were just very attentive to us. They just they cover it very well.
With all of my experience in other places, what I find at St. Francis is their commitment to both the families, the patients, to their staff, that they're at the forefront of trying to bring forth the best for the patient.
Absolutely, I would recommend St. Francis for the delivery of a child for anything. The staff is very caring, friendly, loving, compassionate, and they truthfully care about you.
I couldn't ask for better nurses. It makes me cry. I love my nurses. They were the best ever.
It's second to none. The nurses that we had in delivery were top notch. Boy, it really felt like family here. You could really just get relaxed and be yourself here.
St. Francis is a beautiful hospital, caring staff. The doctors are very knowledgeable in their profession. They're very professional themselves. It's very family-oriented. It's just the facility is remarkable. It's marvelous. I couldn't ask for a better place to have a child.